left the hospital in like 2 hours after.
No shit.
Yeah.
And that was a total replacement, 100%.
It's a resurfacing and a
Okay,
replacement.
alright.
So like they basically, I'll show you after, they chop the head of your humerus off and they kind of put a cap
Mm-hmm.
and they just like embed it on the top of the head where it should be. And then there's a little up in where my socket is. There's just like this kind of, I don't know, it's a titanium or plastic kind of like cap that's
Mhm.
screwed in. So it's just floating.
Now, is that like the hip where if they do resurfacing did they tell you at some point down the line you're probably going to need a total?
No, he didn't. He just said this should be good for me because like one, it's not loaded, the joint. So it's like not like your hip where it's like pounding all the time. Plus also he had to kind of do the resurfacing with me because I have two screws embedded in my humerus from my pec tear. So he can't put a stem in the sense that like usually they put like a stem down in and have the head off. He's like, so there's no point because we're going to compromise that screw. He's like, so I'll just do this. He's like, I've done this before a million times. He's like, it's just as good. So he's like, if anything was to happen, like as you get older, we'd have to do a reverse. So they'd go in reverse way, and it's some of the reverse procedure they do to replace your shoulder. So I don't really think they put like a cap in your socket or something like that, and then there's a stem up, and it rotates the different way, like the opposite way. So, but I mean, so far so good. I've been feeling pretty good, so I'm happy I did it.
It's fucking with my head a little bit right now.